Ever wonder what happens behind the pharmacy counter before the medication ever reaches your hands? So I'm really talking about not inpatient hospital pharmacy, although all of this applies to that as well. But specifically today, I wanted to talk about outpatient pharmacy. The part that applies to all of them are the things I'm going to explain, which is the second, third verification steps and the 5 rights. So the 5 rights that I've talked about before that nurses have to follow and other people who dispense medications to patients are as follows. The right patient, the right medication, the right route, the right dosage, the right time. Route, oral, IM, sub-Q, rectal, vaginal, dispense in the eyes, topical. Just keep that part in mind. All of those 5 rights have to be utilized before any medication can be given to a patient, and that includes the pharmacy. The pharmacy has to check all of those 5 rights as well, as along with many other things like doctor's order, allergies, drug interactions, and more. But even when all of these things are in place, errors can still happen. I wanted to talk about how to be your best advocate to try to mitigate errors related to your pharmacy medications. Why is that important? Because according to the Agency for Healthcare Research and Quality summary, each year in the United States, there are between 7,000 and 9,000 deaths that are attributed to medication errors. And this includes dispensing and labeling steps, which is often what happens with some of these errors. And I'm going to go over a real life error that just happened to me, so hold on to your hats. This is a good one. First step is the pharmacy or pharmacy tech enters the prescription into the system, the computer system, or in some countries they don't use a computer system, so it gets entered. Let's just say that, entered and acknowledged from the physician order. The pharmacist has to review this order and then confirm the data accuracy. Number 2, verifying the physical product and label. All right, so when I tell you what just happened to me, such a simple thing you think, but when I tell you what could have happened, it's really not that simple. And if you look back at how many people die accidentally from errors, the errors aren't just say, for example, anesthesia or doctor or nurse gives something incorrectly or orders something incorrectly. I'm talking about a label, for example, that's put on a medication. That's what I want to focus on. And then the patient takes it home, and something that's supposed to be oral, the patient takes rectal, or something that's supposed to be rectal, the patient takes oral. These kinds of things happen, and there's a way that we could just help to decrease some of these medication errors when the patient is a little more aware, because we have to be. We have to look for all kinds of things like this. And pharmacist then continues to perhaps double check with another pharmacist on the medication. I know nurses with certain medications like insulin, for example, and blood, we have an automatic double check system. We have to have 2 people. Same thing for wasting narcotics. 2 people have to be reviewing this and signing off on this. So after verifying the physical product and the label, the final clinical safety and product confirmation step has occurred. Remember, pharmacists have already done the 5 steps. And then what they should be doing is that consultation with the patient. I know it's missed all the time, at least where I've gone for many years. They assume that if the patient has a question, the patient will ask it. Otherwise, the pharmacists are up over there, up high in the back, not to be bothered. They are very busy. But if you have questions, please speak up and say, can I talk to the pharmacist about this? Make a phone call. Can I talk to the pharmacist about this? I know that often the pharmacy tech is the one that wants to answer those questions or field those questions, but you always have the right to speak with a pharmacist. Let's move on to my current error that just happened to me. I want to show you that in this bottle here of mine, it is a medication that I take for asthma and allergies. It's called Singular. It's a really great product. I've been taking it for many years for asthma and allergies. But what happened is, when I went to pick this medication up, it's a refill, along with my other medications, there was a sticker on my bottle that said Ready? Place one tablet vaginally twice weekly. Use the applicator each day. Okay, so when I was getting rung up to pay for this, I noticed when I picked it up that it said that I'm to take this vaginally. I picked it up and I opened it thinking, is this mixed up with an estrogen tab? Is there supposed to be an applicator with this? Why am I getting it in a bottle form? Is this a complete mix-up with my medications? So all these things are going through your head. And I said immediately, excuse me, over to the pharmacist, you just put a label on for a vaginal tablet to be inserted vaginally on my allergy asthma medication. And she never came over to me. The pharmacy tech came over and peeled off, take it vaginally, insert it vaginally label. And then the pharmacist made a new label and the tech came over and put the new label on. I find this to be pretty appalling because that pharmacist never came over to speak with me. I feel like it should have been her, and it makes you lose trust immediately. When I got there on Saturday, I was coming to pick up a lot of refills. And the reason why a lot of errors, I think, are going to continue to happen there is because the pharmacist that has owned this community, lovely pharmacy for so many years just retired. So there's some fill-in pharmacists coming in and a new pharmacy tech. And there were 5 people behind me. There were people lined up at the window. It was just really, it's set up for error to occur. And then when the error is caught, nobody says anything, not a word. The other thing is that my husband was picking up one of his medications that recently on the news said that it was recalled. And I'm not even going to get into that. One of the steps is that before the pharmacist hands over the medication to the patient, there's one final review that needs to be done. So that was missed along with proper label, double checking the label against the medication. It's just set up for a disaster. Just think if I would have gone home and thought, I don't know. Okay, but other people may have, and they have. You know, when labels are incorrect, the patient is going to read the label and they're going to do exactly what the label says. They might not know that what's inside is not what's on the label and vice versa. So please speak up and please ask questions. And when you come in to pick up or go through the drive-through and pick up your medications for that month or every 3 months or so that you get it, ask the pharmacist exactly what's going on with your medication. If there have been any changes, this pill color looks different. Why is that? Is this label correct that's on here? So this was definitely a medical oopsie. And those are the things that I like to talk about. Education on how errors happen. There's a perfect example on an error that occurred that could have been a problem. Modern pharmacies use multiple layers of technology, of automation, of safety to reduce human error, but it still continues to happen. Remember, you are your best advocate. Don't be afraid to ask questions. When you're picking up your medication, like in this case, for example, look at your pills, look at this. Does that seem right? Does that label match to you? Please speak up and ask any questions that you might have to your pharmacist, or call them later and speak directly to the pharmacist. Because I know that we can go through the drive-through or even stand in line and pick everything up. We get home and we take it out and we look at it and that doesn't seem right. So it's okay to call. It's better to be safe than sorry, because deaths have occurred and will continue to occur due to some of these rights and regulations that are in place that were skipped, that were ignored, or that just human error has occurred. Remember, if you like medical topics, oopsies, I'm going to be doing one about a 5-year-old girl that I'm getting some research together on who gave birth. Have you heard of this case about this little girl in Peru? Yes, I said 5 years old. If you want to hear stories like that and stories that are interesting, myths and facts about medicine, and some fun vlogs too, then please consider subscribing and give it, you know this thing. Thanks.